Hi everyone, welcome back to Karlee's Farm. Today we're going to have a very quick overview of pharmacokinetics. So pharmacokinetics is what the body does to a drug. So when we take something, what's the process by which the body can manage that medication? It's essentially four main processes: absorption, distribution, metabolism, and elimination. And we're going to go through each of those through this very quick tutorial. So when we're talking about absorption, we're talking about how well a drug, or the process by which a drug can get to where it needs to go. And a lot of the time that's into the systemic circulation, so into the blood and plasma. And it's also where the site where it's going to act as well. So most commonly medicines are administered by mouth, so orally. It's a very safe and effective route. But the medicine goes into your mouth, into your tummy, and then how does it get from your tummy to where it needs to go to work? That is the process of absorption. What is required is that the drug cross by biological membranes. So it needs to get across membranes. And of course it can do that different mechanisms, diffusion, carrier-mediated transport, etc. But the other things that matter here are drug formulation, and we can manipulate drug formulations to enhance absorption. The other concept that's important about absorption is the concept of bioavailability. So bioavailability is how available, or what percentage of drug gets to where it needs to go, or to the systemic circulation. So if I take a drug orally, maybe only 80% of that actually gets into my blood because it goes through all these other processes. However, if I inject a drug directly into my vein, then it's 100% bioavailable. It's all there and ready to act. So that is the concept of bioavailability. Bioavailability is indicated by an F, and it's a percentage term. So it's sort of what percent of that drug is active or available to work. The other concept that sort of fits a little bit into absorption is the concept of first pass metabolism. Now I will talk about metabolism in a minute, but basically if you take a medication orally, so this only affects the oral medications. If you take a medication orally, some of that is metabolized before it's even had a chance to reach the systemic circulation. And the percentage of that drug that undergoes metabolism before it's able to get to the systemic circulation is its first pass. So it's sort of, even before it does anything, the first pass of the liver might take some of that drug away. So that's the concept of first pass metabolism. The second pharmacokinetic parameter to talk about is distribution. Now this is a little bit more complicated than absorption. Distribution is how well a drug, or the extent to which a drug distributes throughout the body. So this is a reversible process, so drugs will go back and forth into the systemic circulation, so from the systemic circulation out into other sites and then back again. So it's a reversible process, and there's a few things about the drug that determine how well it can distribute around. So one of the important things is how lipid soluble it is, which we'll talk about again in a minute. Another thing is how well or how highly protein bound it is, because if a drug is really highly protein bound, it's bound to, say, albumin in the plasma, then it's not going to cross over the membranes to be able to go to out of the systemic circulation. So drugs that are highly protein bound can't go out and act. So it's for drugs that are highly protein bound, it's only the proportion of drug that isn't actually bound to protein that's available to act to cross over those biological membranes. And then other things like pH is important too. So some drugs have certain pH, and whether they dissociate, whether they're ionized, etc. Now, the pharmacokinetic sort of equation, or the mathematical part of distribution, is a term called volume of distribution. Now, volume of distribution is indicated, or I guess expressed, as VD. It is a theoretical volume, so it's the volume which a drug would distribute into to be equal to the concentration in plasma. So a drug with a high volume of distribution, a large volume of distribution, theoretically could distribute into a large volume. So these are usually very lipid-soluble drugs because lipids can distribute readily across biological membranes, phospholipid membranes. Volume of distribution is a really important pharmacokinetic parameter when we're talking about loading doses. So a loading dose, LD, is what dose of a drug I need to give somebody to fill up their tank so that there's enough drug in there for them to be at a therapeutic level. So there's enough drug in there to do what we need it to do. So to work out our loading dose, if we know the drug's volume distribution and we know the concentration, sort of target concentration that we're trying to achieve, then we can calculate a loading dose. Now, a lot of the pharmacokinetic equations are taken care of in the sort of regular dose recommendations for different drugs, so taking into account their volume of distribution and their target concentrations. But sometimes these do vary in various patient populations with altered pharmacokinetics, which we can mention a bit later. But that's an important pharmacokinetic equation and concept. Metabolism is the process a drug goes through that of chemical modification. Usually, this is to make the drug more water soluble for elimination. So to be able to be eliminated, drugs need to have some water solubility. But it can also be necessary for some drugs to be active. So some drugs aren't active until they go through chemical modification. These drugs are called prodrugs. So prodrugs require metabolism to be active. Okay. Now, the other thing to remind you about here is that a drug can be eliminated from the body without having to undergo any chemical modification. So it can be what is called eliminated unchanged, or it can undergo metabolism. And there's two different types of metabolism. There's phase 1 metabolism and there's phase 2. A drug can undergo one and or the other, so just phase 1, just phase 2, or both. Phase 1 is called functionalization, and it is the unmasking or addition of a polar group, and it's done by the CYP450 enzymes, and that's usually done in the liver. There are enzymes elsewhere, but primarily a lot of that gets done in the liver. The second phase is called conjugation, and this is where a drug is combined with another molecule to make a bigger, more polar molecule. Now, some drugs, when they undergo metabolism, their metabolite can also be active. So metabolism doesn't necessarily make a drug inactive. It just changes its chemical structure. So that's a really important concept. Some drugs that undergo metabolism will have inactive metabolites, but some will have active. So morphine, for example, undergoes glucuronidation, and actually the glucuronide form of morphine is more metabolically active than biologically active than morphine itself. So that's the concept of metabolism. And now finally, elimination. So elimination is an irreversible clearing of a drug. So it's eliminating the drug from the body. The other term that we can use to describe elimination is clearance, and basically that is the amount of drug that is eliminated from the body irreversibly. So elimination most commonly happens in the kidneys, but not always. It can also happen in the liver. It's very blood flow dependent, so both in the liver and the kidney, so how well blood is getting to the organ that is eliminating is important. This is the other pharmacokinetic parameter that has equations that can be used to actually calculate drugs. So the volume of distribution is important for the loading dose, for understanding how much I need to give to fill my tank up. Clearance is important to understand how much I need to give to maintain my target concentration. And so what I might need to know is the maintenance dose. So what's the ongoing dose? And this is really similar. So what I need to know is the clearance of the drug, and I also need to know what is my target concentration when I'm at steady state. So when I want to keep that concentration steady. So if I know how much drug is being eliminated, how fast the drug is being eliminated, then I can work out how much I need to give to make that concentration stay the same. The other pharmacokinetic term that's really important is half-life. So half-life is indicated by T half, and half-life is the time it takes for a drug for the concentration in the plasma to drop by half. So how long does that take? And in order to calculate half-life, you need to know both volume of distribution and clearance. So there's a term that connects them here, but there's a value that connects them here, and it's 0.693. And if I understand the volume of distribution, then I can calculate that and divide that by clearance to calculate my half-life. Now, half-life's important because if I'm trying to get to steady state, so that state where clearance is equal to inputs equal to output, so that's a steady state, that takes 3 to 5 half-lives to reach steady state. So if I start a drug, concentration at steady state, if I start a drug in a patient, then I know that, and I don't give them a loading dose, if I just give them a maintenance dose, then it's going to take 3 to 5 half-lives before I'm going to get that drug to a concentration that I want it at, that it's steady at. Okay, so that's very quickly pharmacokinetics in a nutshell. Hopefully that wasn't too crazy, too fast. Enjoy. See you next time.